Welcome to Talk Medicine. I'm Dr. Stan Herring, Director of Spine Care at UW-Medicine, and I am pleased today to be joined by my patient and friend, David Shields. David is an author of 9 books and a recipient of many prestigious fellowships and writing awards, and David's latest work, The Thing About Life is One Day You'll Be Dead, is a New York Times bestseller. You know, David, I wish I could have read your book when I first met you. It wasn't written, of course, but instead I got your story in bits. The book is an investigation of the human physical condition, I think. And David, when you came to see me for your first visit, tell me what you thought was going on with your back.
Let's see, that was a while ago. It was September of 2001, so almost 7 years ago. And it's hard to recall exactly, but my sense is that I'd been suffering from relatively constant back pain for the previous maybe 7 years. And I'd gone from doctor to doctor and therapist to therapist, you know, and it would sort of come and go, and I would constantly think, oh, I've solved it, no back pain that particular month, as if somehow there was a solution, and then I'd be lifting something, and then the back pain would return. So I wasn't thinking anything exactly other than I've been tired of this constant back pain, had various solutions or various treatments, and I forget what actually drove me to see you. I had a sense of, boy, this is really seeming to control my life a bit. I have a pretty specific memory of driving, and even the simple fact of turning the steering wheel was causing pain. The pain was starting to become more constant, and you feel like there's a line in the book in which I say something like, a bare body housed in a mortal cage. I felt like that my body had become this odd cage-like trap, where I just felt trapped in my spinal contortions.
You know, it's interesting. So many people will come to see a spine physician, and they tell the same story. You know, I've had this pain, and it goes away, and then it comes back, and everybody wants to know what it is. Mm-hmm. You know, I must have a fracture. I must have a
D4X or something.
Absolutely,
yeah.
They want
right.
the term. I must have a herniated disc. I must have spinal stenosis. I must have an infection. I must have a tumor. And it turns out that while those things do exist, the great majority of times they don't, and about 80% of the time we don't exactly know why people's backs hurt. When I first saw you, you had things that were reassuring, actually, to me. Your legs worked, your sensation was intact, you were still working, you were not taking a lot of medication. And so in my world, your visit was good news. It was not outside the expected. It was my job, however, to begin to help you understand that so much of pain is anxiety and fear. This is hurt, this can't be good. Everybody knows someone who has disabling low back pain. So when I first saw you, I thought this is what we call nonspecific low back pain. Doesn't mean it doesn't hurt, but it wasn't something that needed an operation, and it wasn't something that needed an injection. And what it was something that needed a plan to help you function better. Then you and I talked about the fact that your plan would be different than the next person's plan. I don't know if I used the word crustaliberphobia at that visit, my irrational fear of cookbooks. I always tell my patients, there is no cookbook for this, and it's me understanding you, the pain in your back and the pain in your life. And so my job at that first visit was to help you put this into perspective. Now I know that we did try things for you, and I know that you tried medicine and physical therapy, and maybe you can talk about the interventions that we did take initially to help you move forward.
I think one thing that is important is you had a sense of a self-perpetuating cycle, that The anxiety was creating worse back pain creating anxiety, anxiety creating more back pain. I think you had a sense of myself as a kind of cartoon character who was just, endlessly trapped on the same hamster wheel in which anxiety and pain were endlessly chasing each other. And I think a crucial thing that we did, I would be hesitant to ascribe all of it to that, but you put me on a relatively low dose of Paxil. Not that I was depressed. I don't know. I guess the Paxil is apparently treated for obsessive compulsive disorder. I'm not sure how I fall on that particular matrix, but in your view, I think you thought that it was important for me to get control of my rather obsessive focus on the back pain, which was not only sort of psychologically deleterious, but was actually exacerbating the back pain.
Yes.
Is that fair?
Absolutely, and it was one piece, and
right.
I think the humor was that you were very obsessive over whether you should take it or not. And I thought that was kind of a self-fulfilling statement. But you're absolutely right, and we talked about that, and I told you that that one man's Paxil is another man's poison. It wasn't for everybody, but I thought
right.
that was one piece, but not the only piece.
No.
And the other pieces were physical therapy, for example.
Sure. Like I saw Wolf Broley, and he's a wonderfully good therapist, very learned. We talked about books a lot, but aside from talking about books and philosophy and travel and all kinds of things, Wolf's just an extremely skilled and very intuitive therapist, and he complemented your approach. I'm trying to think of how exactly that we developed a physical therapy program, full of very specific exercises, which I still do to this day. But I think more importantly, he kind of helped me think through this idea of looking at pain as information. Not pain isn't necessarily bad news, it's sort of news, like what can you learn, always looking at it as process. And then aside from Wolf, you put me, I've continued swimming every day. I would just think that's a gigantic thing.
Absolutely.
I swim about 1 hour every day for the last 7 years, pretty much. Walking a lot.
And exercise.
Kind of the other elements that we established.
Oh, sure. And I think people say, well, I'll go to physical therapy. And physical therapy is a generic term, but in your case, and in our philosophy, the idea was to first help you calm your symptoms down. But then when the crisis is over, the work began.
Right.
So I work with a physical therapist or many different physical therapists who can help you rehabilitate beyond the absence of symptoms. So the work got tougher in physical therapy actually when you felt better.
Right.
And his idea was to make you independent and give you a locus of control over your exercise. It's incredibly important so that you didn't feel victimized, that you felt you had some control over progression. And then because of what we know about you, your own love of athleticism, your wonderful stories about really basketball as I think as a metaphor for endless youth and opportunity. We knew that was important to you, and we knew that giving you a piece of exercise was important. And it worked, and you got better, not pain-free, but better, more function, less pain. I think the idea of a relationship between a physician and a patient with a problem like yours being longitudinal is also essential, because that was 2001, and in 2003, lo and behold, you actually did have a herniated disc. You did push a disc out and press on a nerve, and then pain went into your left leg. That's a different spine problem. That's a problem that may need an intervention, whether it's an injection or an operation. But the strength, I think, in our professional relationship and our subsequent friendship was that we already knew and trusted each other. And so this, once again, was not an event. This was, I think in your terms, as in your book, yet one more piece of this continuum, one more piece of the ride. And in that case, we did use interventions. Under X-ray guidance, we put a little medicine right along the nerve that was being compressed, did what's called a selective epidural injection. But even that was one piece. That wasn't the cure. That was the next iteration of helping you through that hurdle. And I don't know if you remember how your symptoms changed at that time.
Dramatically. I mean,
Yes.
it really improved pretty dramatically. I became a big fan of the so-called spinal block. And to me, a big thing that you and Wolf helped me see, I think before, I was very much, and I guess you've already have said this, but I wanted to reiterate it, which is I was very much crisis oriented. For instance, you know, episode X, I'll solve it for X. And now I can go back to forgetting about it. That's sort of an existentially naive way of looking at life, whether it's your marriage or your job or your profession or your relationship to friends. Just sort of patch things up when they blow out. A much more constructive approach to whether it's back or virtually anything else is, you know, kind of an intelligent and joyful maintenance, so that, you know, without sounding sort of Pollyannish about it, you know, that, you know, somehow before it was like, oh, I've got a back problem, quick solve it so I can get back to my life, and that was part of the problem, whereas now I feel like it's definitely part of my daily routine. You know, sometimes I'm definitely lazy about it and not as unbelievably focused as I can, and I think that comes from maybe some overconfidence as you start to develop some real control over it. But the moment it falls down a bit, I sort of bring my maintenance back up. The point I'm trying to make is that you and Wolf really urged me to take a daily approach to it as opposed to sort of crisis intervention, which is what I was doing before.
Right.
And I think that's a really crucial distinction.
You know, and I think that when you find out that you can get through it, it gives you courage.
Right.
It's not, the great majority of patients with back problems don't become disabled, and they can get through it, but the recurrences are incredibly common. And when you understand that, it's less anxiety provoking when they occur. And for me, taking care of you, to see you teaching and writing and trying to keep up with your daughter and exercising is incredibly satisfying because you got your life back. Now, back pain for all of us, for 80% of us anyway, is a part of that, but it doesn't define you anymore. That's the point that's just incredibly satisfying. And the approach to treating back pain in this longitudinal fashion is something which we really like to emphasize to our patients.
I think the one really good example of it was just about 2 months ago, or even a month and a half ago. I was traveling on my daughter's spring break. I went with her and my wife and Natalie's friend to London for 2 weeks. And the moment I got there, pretty much, I had pretty bad back pain. And I'm thinking, great, you know, we've got to London and I'm going to be like the boring dad, you know, complaining about back pain, and they're out, you know, shopping on Carnaby Street or something. And I felt like, wow, this is a real, you know, it wasn't a major crisis, but this is a bummer for sure. And so I feel like I kind of brought out my toolkit, you know, like that I felt like you've given me, and Wolf has given me this sort of toolkit. I said, okay, bring out your toolkit. You know, I found this pool that I swam at for the first several days there. I would use hot baths, you know, to bring down the swelling. I'd walk, I'd stretch, I used meds, and together within a relatively short time, about 2.5 days, you know, that back pain had really dissipated. I felt like it felt really good to have what felt like a kind of knitting bag. Like, let me get out my knitting stuff to repair that torn shirt. I don't knit, as you can probably tell from my mixed metaphor, but, you know, it's like I had my sort of, you know, medicine kit, and I felt like it had many elements to it, from psychological to physical to chemical to whatever. But it was, you know, like, calm down, bring out your toolkit, and that felt really good.
Find the plan that works for the patient, and give the patient freedom and give them control and let them enjoy their life.
Mm-hmm. I think that one thing that you said to me, and I think that Wolfgang Broly said also, that I find constantly useful, and which I constantly quote to my wife and to my daughter, which is, when you experience some mild pain, think of that as some interesting information. Like, let's say you get a B on a particular paper. Let's say that Natalie gets a B on a particular paper. Like, don't think of that as, oh gee, that's cause for alarm, but rather, okay, what information is the teacher telling me to make that a better paper? And in a slightly similar way, before, when I would have pain, it would be like, oh my God, I've got pain, life's miserable. But it's like, okay, what's the information here? I've been writing too much and not swimming. I've been not doing my exercises. I'm tight about this. You know, it sounds sort of corny and slightly new agey, but I think it's really a very useful way. It's sort of like somebody misses their free throw shot. Okay, what do you do to correct it? Don't blame the crowd or blame the referee or your teammate or the ball. You're like, okay, you shot the ball too hard. That's the reason the ball bounced off the back rim. And in a sort of similar way, like, okay, I have a sort of litany of various things that I can go through now. Like, okay, I'm doing this, I'm doing that, and I feel like that concept I found extremely useful.
You know, it's people ask me, you know, so many times, you know, what's the solution? Or what's the answer? What's the formula? What's the cookbook? And this is such an individual problem, and one thing we need to learn about people with spine problems or other musculoskeletal problems is that what works for you is not necessarily the same formula as what works for the next person. And in your case, I think as your fear dissipated, your curiosity increased, and when you found out that this wasn't going to be disabling, it wasn't going to be career-ending, it wasn't going to ever prevent you from hanging out with your daughter, that because I think of your insight, you were able to look at these as you said, sort of almost learning opportunities. And we work so hard with patients to come in and say there is not a single answer, and your answer may be different than the next person's, but it's really picking a program that gives you less fear, successes. One thing about the physical therapy is we could treat your successes, we could find things that you could do. And then this learning. You're better at your back pain than you were in 1993.
Right.
And you're winning in that regard. And it's so important to try to make people understand that a simple solution for a complex problem is awfully wrong. And it doesn't, what it really does was I don't think that the patient can abdicate their participation in this.
I think that's crucial. I think that was like I was constantly sort of coming to you at the beginning and to Wolf with sort of, you know, please give me the golden passkey to back nirvana, and that obviously doesn't exist. I mean, I guess occasionally one casts slightly jealous glances at, you know, friends who got, you know, back surgery and they're apparently fine or something, but for me, and it's rather, again, I don't want to overstress this stuttering thing too, but as a kid growing up with a fairly severe stutter, I was always looking for solutions. And I think that now it's just something I've come to learn to live with and to very much work with. And in exactly the same way with the back stuff, that, you know, there are no solutions to life's problems. There just aren't. You know, we all die. You know, the last line to the book is pretty much, you know, that in the end we all lose. You know, nobody wins this game, and we all die, and that's an overwhelming thing. And that's the thing that the book tries to get the reader to realize, and yet in a strange way kind of groove to it. We're all bozos on this bus, as that album used to say from 30 years ago, which I really love. You know, we're all sort of gorgeously flawed human beings, and the book tries hard to get the reader to see that I'm, you know, a flawed human being, both physically, psychologically, and I'm trying to be candid about that. But I try to get the reader to feel in his or her bones as well, they're mortal too. And if you're going to love your life, you better dig that fact, because otherwise you'll always be fighting it, looking for solutions like heaven or back pills or stuttering pills. The best way to love life is love life's processes and life's bumps and bruises, which isn't to say that you embrace the pain, but you kind of acknowledge there's always a rock in the garden. That's a crucial concept to me. If you're always looking to have the garden be this pure, flat surface, you're always going to stub your toe on some rock. Better to acknowledge there's always some rock there and make the garden perhaps work around it.
Back pain is not new. I mean, Hippocrates wrote about back pain. There's biblical references to back pain. There was a patron saint for lumbago. So certainly it's not new. But you know, it's interesting, what is new about back pain is the disability associated with it. That's a 20th and 21st century phenomenon. There weren't legions of the Roman army on disability for their low back pain. It didn't exist. It was only until back pain sort of became medicalized, you know, meaning that we, ironically, that if culture sort of accepts the pain is one thing, but when you begin to offer the cure, then the pain becomes unbearable.
Starting when? Like, say, turn of the 20, like around 1950 or so?
Sure,
or before that?
we could do more things. We had more tests and more interventions and more procedures. And back pain, it's easier to have back pain than it is to sort of admit that you're ambivalent about where you are in your career. And it's easier to have back pain than it is to admit that you have depression or anxiety issues. It's more culturally and socially acceptable. So one thing for us is to do just what you said, to say this, and as you and I have talked about, the pain in life is mandatory. It's the suffering which is optional.
Right.
And there are great advantages to technology. And at UW-Medicine, we do spinal injections. We did 2 for you at one point in your career. And we have wonderful spine surgeons. And we have a whole group of people for those gilded few who you say who do need that intervention. People must understand, though, that 98% of spine problems don't need surgery. And the great majority of spine problems are not solved with technology. They're solved by this journey which you articulate so much more clearly than anyone I've ever met. Exactly what you said, this understanding that life isn't perfect, but not allowing yourself to be victimized by that. I guess maybe finding a new measure or yardstick for success. That
was something which I actually quote in the book, that I met with you the first time about a week after the 9/11 suicide bombers. And you said, interestingly, that it was an interesting reading where you said that you viewed the suicide bombers as people who had fetishized their own pain. I'm not sure if that was your exact term, but that was the way that I said it to myself. And you basically said, you know, don't let yourself become a suicide bomber,
right,
at least figuratively, which is to say, don't fetishize your own pain. Don't be this person who becomes a professional back pain sufferer. I mean, there's nothing more boring, you know. And in a way, like, that would be my worst fear about the book, is just like, you know, oh, my back, you know. That's not a very interesting topic. But if you can somehow flip that so that, first of all, that you, I mean, I think in the chapter in the book, which was written a few years ago, or even several years ago, I would say that the back pain in the book is considerably worse than it is now.
I guess one of the great pleasures of being a physician is you can meet patients and become friends with them, and you've certainly enriched my life. And I think, to summarize this, what I have learned from you, and I learned something from every patient, is that it's important to find out what the patient believes. When all else fails, ask the patient. It's important to know the patient over time, because as you and I got to know each other, I think you felt more comfortable asking questions, and I learned about who you were better. And I can help you navigate the bumps, because pain is not fun. Yes, it does hurt. But what was most satisfying for Wolfgang and myself and everybody else involved in your care, my whole office for that matter, was to see you take this episode and turn it into a teaching point for yourself and for your readers and for the healthcare providers. And I think that in this era of technological advancement, in this era of trying to do more procedures to solve more problems, this remains a very much patient participating management issue about function, so people can get their lives back. Well, David, thank you for your insights and for your willingness to come and speak with us, and for the pleasure of watching you enjoy that human physicality as much as possible for as long as possible. Thank you.
Thanks very much, Dan.
Thank you for joining us on Talk Medicine. We hope to see you soon.